No, it wasn't a problem at all coming over to see you. No, I told you if you ever needed anything, just call and ask. I was on my way home, so pretty simple to stop and help you out. Okay, so what happened exactly? And you were drinking when this happened? Okay. How long ago did it happen? Okay, well that's not too long at all. Any loss of consciousness when you hit your head? Like you don't remember when it happened or immediately afterwards, or did anybody say you lost consciousness? Okay. Any nausea or feeling like you're gonna throw up? Okay. Any strange thoughts? Right then. Okay. Well, let me just double check. The laceration right through here, it looks pretty superficial, but just better to check you out and be sure. So I'm going to shine a light in your eye, but I want you to look up at the corner of the little tiki bar here, okay? Alright. Okay. One more time. Okay. Alright. Now I just want you to follow this, just my little pin light, with just your eyes, not your whole head. Okay, and I'm going to move it in really close to you, and I just want you to keep following it. Alright. Everything looks good. Just a few questions, just to be sure. Do you know what today is? Do you know where you're at? Okay. Do you know who the president is? Okay. Alright, doesn't sound too serious to me. So let me get some gloves on and just check out your heart rate and blood pressure and just make sure that everything's okay, which it seems like it is, but better safe than sorry. Okay, so I'm just gonna put my 2 fingers right here on your thumb, like right below your thumb, so I can feel your heart rate, okay? But just be still with that arm, alright? Okay. Okay, your heart rate looks good. It's actually on the low side of normal. Oh yeah. Are you an athlete? Yeah, usually athletes have lower than normal heart rates. But let me get your blood pressure. Just to make sure, yeah, if you had a head injury, I might expect to see some blood pressure changes. So let me go ahead and get yours. Okay, I'm just going to wrap it around this arm, right? Okay, and then just relax that arm. Now I need you to stay completely relaxed so that I can hear exactly what your blood pressure is, okay? Your blood pressure seems to be 120/80, which is perfectly normal. That's the exact description of a normal blood pressure. Alright, so everything is looking fine. Just let me take a look there at this wound here on your forehead. Okay. And, okay, so you were jumping off the dock and you hit your head on the dock? Uh-huh. Okay. Alright. And there's some metal screws on there. Okay. Let's see here. Okay. I don't think I'm gonna need stitches. I think I can just use Dermabond to get the skin back together. It's like super glue for skin. Prevents sutures, the skin heals faster, no necessary removal of sutures. So let me just get some out. Okay. I'm gonna put it up here. Okay. Yeah. And it kind of feels like super glue. Right. Okay. Alright. It is kind of oozing a little bit, but it's not an odd color. It doesn't smell. So I'm just going to put a small bandage on it. It's not really a bandage. It's just gauze. Just helps absorb some of that drainage. Drainage is good. We don't want all that fluid building up under, under the laceration. Then you could get an infection. So I'm just going to use this. Okay. And then I'm going to use a piece of tape to just hold that in place there over top of the wound itself. And then another piece of tape. Okay. Alright, it looks good. Yeah. Now what I would be concerned about is if the drainage turned green or yellow, or if it started to smell, then I'd be worried about an infection. Okay. Yeah. Right, so I did bring you an ice pack. This one's kind of neat because it works both ways. You can heat it up in the microwave, or you can put it in the freezer and use it as an ice pack. So I want you just to put it right here, but don't leave it on for more than 20 minutes. After that, it can start to burn your skin. Yes, old stuff can burn your skin. So leave it on there for about 20 minutes at a time, and then leave it off for 20 to 30 minutes afterwards, and then put it back on. Sometimes it just means that they do both cold and hot. Okay. Yeah? Oh, you did? Oh, okay, well let me see that too. Let me see that that ear there. Okay. It looks fine. It looks like it's just a little scratch. Doesn't even need a Band-Aid. Oh, your hand? Okay, well let me look at your hand here. Yeah. Hey, can you squeeze my fingers with your hands? Squeeze them as hard as you can. Okay. All right. And can you wiggle your fingers? Okay. All right. Can you make a fist for me? Okay. Let's see this one along the arm here. This one looks okay too. It's not bleeding. Just looks kind of like a big scratch. Yeah. But it looks fine. It doesn't look like it needs any sutures or Dermabond or even a Band-Aid. It looks like just a minor scratch. Yeah. Okay. Alright. Any other concerns or anything before I head out? No? Okay. Well, I would suggest not drinking anymore and trying to swim. But it's a free country, so if you want to do that, call me back when things go wrong.